Well, anxiety can happen for anyone at any age and at any time. The past 2.5 years has not made things easier, especially for children. This next segment has been sponsored by the Compass Health Network. And joining us is Dr. John Bilter, affectionately known as Dr. Jack. Doc, thanks so much for being here with us today.
Oh, thank you so much for having me, Miss Haynes.
Of course. We were joking in the commercial break. You're hilarious. But I mean, you are the director of family medicine at Compass Health. And I mean, Doc, you're a pediatrician. What really sets Compass Pediatrics apart from the rest?
Yeah, so I think there's two things that set it apart, and you kind of alluded to one of them. But the first thing is that we really focus on the entire family. I'm a pediatrician, but I'm also one of the directors of family medicine. Because a healthy kid requires a healthy home. So that's something that we really focus on. The other thing that we focus on is a team-based approach to medicine, and Compass Health is by far the place that has the most specific members in a team that I've ever worked in for a pediatric clinic.
Wow, and that is phenomenal. I mean, you all really do cover really the entire state of Missouri, and today we're touching a little bit on anxiety. Tell us a little bit about mental health when it comes to pediatrics.
Yeah, it's been really difficult, and I think anyone with a teenager or a kid knows that over the past couple of years. Recently, there have been a lot of research and even recommendations coming out from different task forces like the U.S. Preventative Services, saying that we need to now screen these teenagers for anxiety and depression and suicidality.
I mean, it's an important conversation to be having with kids as well as those teenagers. And I mean, you just mentioned how integrated of a health network that Compass Health Network is. I mean, you all really do have a team-based approach when it comes to working sure and talking through a lot of these mental health issues, anxiety, when it comes to pediatrics, right?
Yeah, we sure do. And that is the best thing about Compass Health, is that I can walk down the hallway and speak with one of the behavioral health consultants who's working on solutions to these healthcare barriers, or walk down and speak with our pharmacists in the building to talk about drug interactions if these kids need to be on medications for help.
Absolutely. Everything is kind of housed all under one roof, the doctors, the therapists, the dentists. You've mentioned it just a little bit throughout our interview, but what's the best part about working for this organization?
I mean, it's got to be the people, right? And having this team-based approach where we sit down all together and make sure we focus on individualized, integrated medicine for these people is the most important things, involving the therapists, the psychiatrists, the dental people, the dentists, that's what they're called.
There you go.
Yeah. Everybody involved so that we have a well-rounded care of these kids.
Well, Dr. Jack, thanks so much for sharing a little bit of your heart here with us on Studio STL. And if you're interested in learning more about the Compass Health Network, you can visit them online at compasshealthnetwork.org. You can also follow them on Instagram as well as on Facebook and Twitter. Show them some love on all of those platforms. And really, this organization is phenomenal. Their mission is to inspire, hope, and promote wellness all across the state of Missouri. It's a nonprofit healthcare organization. And again, if you want to learn more, all that information is right there on your screen. Dr. Jack, thanks for being here with us today.
Of course. Thank you so much for having me, Miss Haynes.
St. Louis Don't Go There. We'll be right back in just a couple of minutes.